First of all, you should make sure that your health is up to par as you can have it. For instance, if you have blood pressure problems, you need to get those well controlled before you get pregnant, on as few medications as you can, and to control the blood pressure. If you have diabetes, you want to get your blood sugars controlled. You want to make sure you're as healthy as you can be. You want to make sure you're as close to your ideal body weight as you can be. If you're significantly overweight, then you may want to try to go on a weight reduction program before you get pregnant, because there are clearly increased risk with significant obesity. And the same thing is true with people who are significantly underweight. You may want to gain as much weight as you can so that your outcome for your pregnancy can be maximized by your getting as close to your ideal body weight. You want to make sure common sense things are up to date, like your vaccinations, your tetanus shot, things like that. You know, you can get a tetanus shot while you're pregnant, but you'd rather not. You don't need to. If you get it before you're pregnant and you inadvertently, injure yourself or whatever, then you can avoid having to have it while you're pregnant. The same thing is true with things like rubella vaccinations, if you haven't been vaccinated for that. Hepatitis vaccinations, those things should be up to date. If you know that you're not immune or you haven't had chickenpox in the past, then you should definitely consider getting it before you're pregnant so that you can avoid the problem if you're exposed to someone while you're pregnant who has chickenpox, because that can have significant implications for the pregnancy. If you're considering pregnancy, you should also make sure that you're consuming folic acid. Folic acid helps to reduce your chances of having a baby with a neural tube defect or spina bifida. And in general, you should start the folic acid at least 1 month prior to the time that you anticipate conception, although nobody knows exactly when they conceive usually. And you should continue that through at least the first 3 months of the pregnancy. As far as supplementation with other vitamins, if you have a normal U.S. diet, well-balanced diet, most people believe that you don't need extra vitamin D. The people who might need extra vitamin D are people who are complete vegetarians, people who don't eat any animal products whatsoever. Some of those people don't get enough vitamin D in their diet and have to be supplemented. And then generally you want to be as physically fit as you can. Patients who are in good physical condition, who exercise regularly before pregnancy, tolerate pregnancy and the labor and delivery process much better than women who are not in good physical shape.
What about the father? What can he do to make sure that he makes himself as healthy, or does that matter?
Adequate sperm production and healthy sperm production is also predicated on a healthy father, too. You need to be, optimized at your health, optimized in your physical capability, those types of things. I think from the standpoint of production of sperm. From the standpoint of pregnancy outcome, what the father can do is to try to support his partner in achieving the goals that I mentioned earlier about, getting to your ideal body weight, getting physically fit, getting all your medical conditions addressed. Support your partner in doing that and maybe do it together.